Katie Jackson, Medical Secretary for Central Maine Orthopedics, CMO. Now that you're scheduled for your joint replacement surgery, I'd like to introduce you to the Orthopedic Institute of Central Maine, the OICM. This is where you will have your surgery and be cared for by your orthopedic team.
I'm Elizabeth Turcott, the nurse manager. This video is designed to help you prepare for your upcoming total joint replacement at the OICM. It's divided into 9 sections: pre-admission visit at Central Maine Medical Center, patient preparation, your surgery day, pain management, treatments, planning your discharge, after hospitalization, when to call your doctor, and extending your body's warranty. Whether you are viewing this on TV via DVD or on a computer screen, you can watch from beginning to end, and then, if you wish, go back to any section you would like to see again. Don't worry about taking notes right now. We'll give you a patient information kit that includes the information in this video. We recommend that every patient also plan to bring a friend or family member to be their recovery coach, and that they watch this video along with you so you can both learn together. Let's get started.
Once your joint replacement surgery date has been set, you'll be scheduled for an appointment at Central Maine Medical Center where you'll go through a pre-admission process. When you come for this appointment, please bring a list of all the medications you currently take, both prescription and over-the-counter. This information is very important for your surgical team to know. While you're at CMMC, we'll review your medical records, and a pre-admission testing nurse will review your medical history. We'll conduct various pre-admission tests, possibly including blood work, a urine sample which checks for urinary tract infections. We'll swab your nose to check for staph infections. An EKG will be done to check for your heart's health, and other tests may be ordered specific for you. The pre-admission testing nurse will give you specific instructions to prepare you for your surgery. You may be asked to start taking iron tablets, specifically 325 milligrams per day of ferrous sulfate, for 4 weeks prior to surgery. Avoid any dental work 5 days before surgery. Even a cleaning can cut your gums, which increases your risk for infection. Use a Hibiclin scrub or wipe from your neck down over your entire body. These will be provided for you at this visit. Bactroban ointment may be recommended to prevent staph germs from colonizing in your nostrils. Please apply this in the evening and use a very small amount in each nostril. Applying too much can be irritating to your throat. You may receive other instructions based on your procedure. Your pre-admission nurse interview is also a great opportunity for you to ask any questions you may have. You'll be instructed to call 795-5501 between the hours of 2 and 4 p.m. the day before your surgery, or on Friday if your procedure is scheduled for Monday. We will let you know what time to arrive on the day of your surgery.
Please know that we are a group of caring people as well as an orthopedic team. The way we work together is a very special approach we call Core Connect Care. We use this approach to ensure the best possible patient outcomes. This has led to shorter hospital stays and a faster recovery period. The very best outcomes happen when patients are well informed about their upcoming surgery. We strongly recommend that you participate in a total joint education class. These are held here at Central Maine Medical Center and are given on a regular basis. We'll help you find one that's convenient for you.
On the day of your surgery, please plan to arrive at same-day surgery at your scheduled time. The time you were given will be earlier than your surgery time in order to give the RN team time to prepare you for your surgery. Be sure to bring a coach along with you. It's important to have someone else lend support, ask questions, and be there for you. Ideally, this coach will provide assistance after your surgery and during your recovery period. When you first arrive at CMMC, enter through 60 High Street, proceed down the long corridor into the Memorial Wing, take the elevator up to the 2nd floor, turn right off the elevator, and same-day surgery will be the first left. You'll be asked to change into a warming gown. A pre-op nurse team will complete a full assessment including vital signs and will start an IV. For this initial assessment, your coach will be asked to wait in the waiting room until you are changed and the nurses have finished their assessment. They are more than welcome to join you directly after. Once your surgeon is ready for you in the operating room, you will be transported to the holding room. At this point, your coach will wait for you back in the same-day surgery waiting room. The surgeon will call your coach after completing the surgery. There'll be a wait time of approximately 1 to 2 hours before you're brought back into your room at the Orthopedic Institute. Once you're settled, we'll give your coach a call and have them come to your room.
This is the area where the final preparation and safety checks are conducted prior to heading to your operating room. A major portion of this will be meeting your anesthesia team. The anesthesia team will consist of an anesthesiologist and a certified registered nurse anesthetist. Your anesthesiologist is a physician specially trained in anesthesiology and perioperative care. The anesthesiologist will assess all of your medical information and ask you several questions pertaining to your medical history and current state of health. This is part of the final checklist to ensure that you are optimally prepared for surgery and to help guide us in our final anesthetic plan. Once this is completed and a final check of the room and materials have been completed, you will be taken to your operating room.
Once you're in the operating room, you'll be greeted by the rest of your surgical team. You'll be asked to move over to the operating room bed. Your nurse anesthetist will be placing monitors on you while your nurse will be making you comfortable on the bed. You will then be given medication to induce anesthesia. You'll be monitored throughout your surgical procedure. You are in the very best hands at the OICM. Once your procedure is complete, you will then be monitored in the recovery room.
This animation of hip joint replacement depicts an arthritic hip with the muscles and tendons removed. During hip replacement surgery, the cup or acetabulum is replaced with a metal insert with a plastic implant. On the femoral or leg side, a metal implant is also inserted with a femoral head attached. These two pieces of hip joint join together to form a pain-free hip joint with full range of motion.
When your surgery is finished, you'll go directly to the recovery room. The recovery room is also called the Post-Anesthesia Care Unit, or PACU. In the recovery room, you will wake up from your anesthesia. You will have a registered nurse caring for you while in recovery. Your nurse will make sure that you are warm, receive appropriate pain medication to help manage any discomfort that you have. When you are awake, warm, comfortable, and your vital signs are stable, you will be transferred to your private room on M2. You'll see that we've made every effort to make your room as home-like and welcoming as possible, including seating for visiting family and friends. We will let your coach know where you will be going.
After your surgery and a rest period, we will help you get up and walk. We will of course assist you so you cannot fall. We'll help you get out of bed, we'll use assistive devices such as a walker, and we'll assess your ability to bear weight. You can expect to do exercises with one or more of our certified physical therapists. Please bring in loose, comfortable gym-type clothes and footwear to use with your therapy sessions during your stay with us. You will learn how to walk with a walker or crutches, and you will learn how to do stairs. Your therapist will have an exercise program for you to continue on your own at the hospital and at home.
You will be visited by your occupational therapist on post-op day 1 or 2, depending on how your recovery is progressing. The occupational therapist will be meeting with you to review your total hip precautions and talk to you about how you will perform your daily activities such as bathing and dressing and toileting while maintaining those precautions. The OT will be bringing in tools, which are called adaptive equipment. They will show you how to use this equipment to wash and dress yourself without bending, crossing your legs, or turning inward. Please bring in loose, comfortable clothing and footwear to use with your therapist during your stay with us. The therapist will also talk to you about your bathroom. They will want to know how your home bathroom is set up and will discuss options for bathroom equipment with you. It's helpful for you to check before you come into the OICM to find out ahead of time from your insurance carrier what, if any, bathroom equipment is covered under your particular policy. The therapist will review your home setup with you also. We strongly encourage you to prepare ahead of time by making sure you have attended to basic safety issues such as having night lights installed, eliminating scatter rugs, placing items you use frequently at easily accessible heights such as a countertop so you don't have to bend or lean over to obtain them. Prepare ahead by making and freezing items to lighten the burden post-operatively. Be sure your pathways around your home are open and free of clutter to allow you to move about more easily and safely. Have family and friends lined up to be able to stay with you and assist you as you recover.
You will have hip precautions, which are guidelines. Do not move your knees higher than your hips. For example, sit in an elevated chair. Do not cross your legs. Do not turn your legs inward. Your doctor will tell you when you can stop following these precautions. Your therapist will help train you to manage steps and stairs. Do not attempt to take stairs the normal way with one foot on a step and the other above or below it. You will go up with your good unoperated leg first, then bring your operated leg up to that same step. The therapist will show you how to go downstairs in the same way, leading with your operated leg. Your therapist will put together a program for you to continue on your own in the hospital and at home. Talking to hip replacement patients from the OICM reinforces what we already know. Patients who follow their therapy instructions will be back to normal everyday activities and the sports and hobbies they enjoy more quickly than patients who do not. So plan to be active. You may bring a change of clothing. You may also bring your own assistive device to use, but we do have devices to loan to you while you stay in the hospital. We will help you get the equipment you need for home if you do not have any.
You will be using a sock aid to put on your elastic stockings as well as your regular stockings. You'll face the heel of your stocking to the floor and then begin to gently pull on your stocking onto the sock aid. Pull it all the way on. Once your stocking is fully on, take the ropes, drop your sock aid down to the floor, place your foot in the sock aid, and pull your handles evenly and slowly until the sock comes onto your foot. To get it up fully, you will then take your dressing stick, place it on the inside of your leg, reaching down to grasp your stocking. And bring it up to your knee where you can grab it without bending over, and then pull the stocking all the way up to your thigh. To remove it, you will push it down to your knee, grab your dressing stick, place it again down the inside of your leg. This will help you to prevent you from turning your leg inward, and keep working to push your stocking all the way off. To put on pants, shorts, or underwear, you will always put in your operated leg first. You'll take your reachers, grab the waistband, put your operated leg in first, then place your unoperated leg in. When you undress, do the opposite. You will take your operated leg out second. When putting on shoes, we will place elastic laces in your shoes so that you don't have to bend over to tie or untie. You will start the shoes over your foot with your reacher, keeping your knee lower than your hip. Then you will grab your dressing stick, which on the other end has your shoe horn. You'll place the shoe horn in and slowly slide your leg forward until your foot goes fully in. When you wish to remove your shoe, take your shoe horn, once again stick it on the inside of the leg, push forward.
There are many ways to manage your pain. We will monitor you to gauge your level of pain. We will also make recommendations for pain management once you leave the OICM. Of course, you can always contact us at any point after release with questions in regards to your issues with your level of pain. While you're here, we will have you rate your pain on a pain scale. It's going to be on a scale of 0 to 10, 0 being no pain, 10 being the worst pain you've ever felt. This helps us gauge exactly how effective our medications and other therapies are to controlling your pain. You'll have pain medications. You'll have both IV pain medications and oral pain medications. Once you come back from the recovery room, you'll start with IV pain medications, and we will quickly try and get you transitioned to oral pain medications. To do that, we'll have you have something to eat, make sure you're not nauseous, and then start with oral pain medications. It will be important to make sure that prior to doing physical therapy, by about a half an hour, you have something for pain in your system to aid in physical therapy.
Some patients require IV fluids until they're able to drink and go to the bathroom on their own. You will have a short course of IV antibiotics to help prevent surgical site infection. Many patients experience constipation after surgery. It's generally a normal bodily reaction to the anesthesia. There are ways to manage it, and we will provide you with information. One of the most important areas when it comes to treatment is self-care assistance. We will monitor you while you are at the Orthopedic Institute. Based on your specific surgery and condition and our specialized orthopedic knowledge, we will put together a self-care assistance program you can use at home. Every surgical patient on their post-op day will be bed alarmed for their safety. The medication you receive makes you sleepy and sometimes disoriented. It's important that you follow recovery instructions provided to you upon your release. Your coach can provide a major support for you in your recovery at home. Other areas of self-care include your diet and your medication intake. You will be given a blood-thinning medication to help prevent blood clots. These are to reduce your complications related to your surgery. Take the correct dose at the same time every day and take the entire dose. While you're taking blood-thinning medications such as Coumadin and Lovenox, do not take aspirin or medications including aspirin such as Motrin or Advil. Avoid drastic changes in the consumption of foods that are high in vitamin K, which are green leafy vegetables. Avoid drinking grapefruit or cranberry juice. These affect how your medications are metabolized in your liver. You'll also be asked to come in for a blood test, or we'll set up home health to do your blood test. It's called an INR, which measures the clotting factors in your blood. Your medication dose will be adjusted depending on that lab. Take the correct dose at the same time every day, which we recommend that you take it with your evening meal. The entire dose needs to be taken at that time. Your dose will be adjusted often. It's helpful to record it on a calendar as it changes. What do your lungs have to do with your knee replacement? Plenty. That's why we'll show you how to use a spirometer, which is a lung capacity measuring device, and give you goals to set while you're in the Orthopedic Institute and when you go home. Here's why it's so important to get your lung capacity up. Using an incentive spirometer clears secretions out of your lungs to prevent pneumonia. This device ensures adequate oxygenation to the body to promote healing. Keeping your lungs inflated prevents the secretions from forming, and we'll encourage you to use this device 10 times an hour while you're awake. It takes a little time, but it can make a big difference in the speed of your recovery, and it helps prevent complications. TED stockings are a compression stocking to squeeze your blood back up to your heart to prevent blood clots. Wear them at all times except for a few short breaks while you're in the hospital. At home for 6 weeks, wear them in the daytime, but take them off at night, hand wash them, and hang them to dry. While you're in the hospital, we will use flotrons, which are sometimes called SCDs, to mechanically stimulate the blood flow. This machine simulates walking by squeezing your calf muscles and pushing blood back up to your heart. This action prevents blood clots from forming.
Planning your discharge ahead of time is very important. We will work with you to make sure you feel comfortable about your treatment, recovery, and everyday activities. Take this opportunity to tell us if you have concerns about going home. You will want to formulate a plan with your family to make sure you have the support you need at home. It is also helpful to have your coach or family member attend physical therapy. We will discuss any services that may be needed after your discharge from the OICM. Case management personnel will help you through your process and will be available to you after your release. Read your total joint bingo card located in your patient information kit. It outlines all of the steps and milestones to a full return to normal.
After hospitalization, you are still our patient after your release from the Orthopedic Institute at Central Maine. We are here for you. We will provide you the information and materials important for your recovery. And you can call us or your primary care physician at any time if you have any concerns. You can expect to leave the Orthopedic Institute with discharge instructions with phone numbers in case questions arise, signs and symptoms of infections, wound care instructions, appointments scheduled for lab work, Lovenox, which is your short-acting blood thinner, may be prescribed, prescriptions for Coumadin, which is your long-acting blood thinner, pain meds as needed. Please do not take aspirin or aspirin-containing medications when taking any blood thinners. Follow-up appointments for your possible staple removal and your 6-week checkup will be made prior to your surgery. A list of precautions, warnings, and advice to follow as you heal.
Do not take any chances with your health. If you feel something is wrong, ask for help. Any trouble breathing or chest pain, call 911. If you have any of these other symptoms, please call us right away. An increase in pain or swelling in a calf or leg, unusual redness, heat, or drainage at the incision site, a fever of 101 degrees or higher.
Extending your body's warranty. That might sound cute, but we're really serious. No different than a car or an appliance you might buy. The better you treat your body, the longer it will do the things you want it to do. Maintain a healthy weight. Proper nutrition is your best friend. If you'd like a referral for weight loss or nutrition, just ask us. Keep your body moving. Limit your time in front of the television and in front of the computer. Additionally, add exercise to your daily routine. You will grow stronger much more quickly. Certainly you need to choose an activity you like. If you hate the stationary bike that you own, you will not use it. On the other hand, if you love to dance, find a dance-oriented workout class. It's easier to exercise if you have a buddy. The same goes for losing weight or quitting smoking. Do it with a friend or get help from a proven program.
You're on the road to a better quality of life. Your new hip is going to help you do the things you need and like to do. We're here to help you regain mobility and lose the pain. Once again, welcome to the Orthopedic Institute of Central Maine.